Welcome to Stories of the Lockdown, a podcast by India Spend and Nicor Associates. Here we seek to shed light on women's narratives during COVID-19. The pandemic has disproportionately affected women, deepening pre-existing gender divides and setting back gender equality. While each episode will have a different sub-theme, the broader focus will remain on women and their lives under the lockdown. For today's episode, I, Samiha Singh, will be your host. I am joined by Ms. Ayman Haq, a research associate at SEVA Bharat Learning Hub. Thank you so much for joining us today, Ayman.
Thank you, Samiha, for inviting me. It's really nice to be here.
To start off, could you give us an introduction to SEVA Bharat and your role in the organization, please?
Yeah, sure. So, SEVA in itself is a central trade union, and SEVA's membership now, as of 2021, consists of over 1.9 million female informal sector workers. SEVA Bharat is like a federation, an all India federation of self-employed women's associations. So, SEVA Bharat comes under the larger union of SEVA, and it's like SEVA Bharat came into being to basically give like a national identity to SEVA's struggle. We have another federation in Gujarat too, and it deals with the cooperatives of SEVA that are there in Gujarat. And SEVA Bharat, which is based out of Delhi, is more like a national federation of various SEVA institutions across India and across trades. And it does the work of creating synergies and linkages between the various SEVA institutions spread across multiple geographies of the country. So, any SEVA work is done through the double-pronged strategy of struggle and development. So, struggle is where the work of the union comes, where we advocate for our informal sector workers, and all of the work that we do is to basically attain rights for the informal workers. And development is where we work for the economic empowerment of the women in the informal sector that we work with, and it is done through various strategies. And social enterprises, building and developing social enterprises is one of them. And the ultimate goal of any development programs or activities that we do is to achieve full employment and self-reliance for our members. So full employment would mean jobs that provide economic security, food security, and social security. And self-reliance refers to economic self-sufficiency and equitable roles in the decision-making process. So coming to the point about social enterprises, my role as a research associate in the Learning Hub, which is the data and research vertical of SEVA Bharat, has to do with social enterprises. So I'll be talking about the project under which I'm working briefly. So the project is MOVE project, which is Mahila owned viable enterprises, and it's a SEVA Bharat and BMGF Bill Melinda Gates Foundation project where we are exploring the relationship between social enterprises and women's economic empowerment to basically develop proof of concept of the models and of the social enterprises that exist in SEVA, and answer a bunch of questions which include but are not limited to say which of SEVA's different models of collective enterprises work well, what kinds of effects do they generate, etc. So my role as a research associate, as I mentioned before, includes research and data work on a wide variety of themes related to the lives and livelihoods of women in the informal sector, with a primary focus on women-owned social enterprises within SEVA, and more recently on the effects of the COVID-19 pandemic and the subsequent lockdown on female informal workers. I've also been involved in building a grassroots data collection team in SEVA, as well as a grassroots data collection social enterprise that has various teams of grassroots data collectors all over India in different states, and also a grassroots researcher team with a colleague at SEVA, Sabha, who have more skills than just data collection. So they can write case studies, they have been trained to use various Microsoft applications, etc. We've done a lot of skill building with them, and that's like a different conversation to have. But yeah, to give an idea of the work I do briefly, these are the things that I've been working on.
Okay, thank you so much for that introduction. As you were saying, in your observations, could you let us know what were the key challenges of the first wave of the COVID-19 pandemic on your organization and also the informal workers that you work with?
Yeah, sure. So, I'll briefly touch upon the effects of the pandemic in the first wave that happened. So, even during the first wave, we had done extensive research and data collection with our members to understand the sort of effects that had happened on our members. The most important thing to keep in mind is we work with multiple sorts of trades, both across urban and rural regions, and every trade was affected differently. There was no homogeneous effect on all of the informal sector, and that is what makes it more complicated too. So, if I'm to talk about some of the trade wise impacts, for example, the agricultural workers. So they could continue their work through the lockdown, but they were not able to transport their produce to larger markets. So, which meant that they could not sell it and they could not get a price for it. And a lot of the agricultural supplies, the price for those supplies had gone up, which had forced a lot of these agricultural workers to rely on subsistence farming to feed themselves. Or if we talk about domestic workers, so they were facing an increased health risk, as many employers were still calling them to work. And on the other hand, if they were not being called to work, then there was the precarity around income. They, whatever source of income they had was being cut off, because in a lot of households we found out that the employers were not willing to give them their salary irrespective of whether they were coming or not. So they were in a very uncertain position. Or if I take the example of weavers or home based workers, they saw a very sharp drop in demand since the beginning of the year, even before the pandemic started. And they were very unsure about how the market would pick up post lockdown. So, through these examples, I'm trying to explain to you that the effects of the lockdown and the pandemic were varied across trades, and there was no one solution that can be applied to this. There would have to be like different solutions according to the needs of the respective trades and their geographies, which would actually help them on ground. If we are to talk about the second wave, in the second wave, the health effects were much more severe than the first wave. From what we saw amongst our members, when we talked to them about it and when we tried to understand the effects, there was a greater level of burnout noticed among the members. When we talked to them, there was a greater level of worrying and anxiety about the disease and how it would affect their families and whether they would be able to access healthcare infrastructure. So as we saw, there was like a complete breakdown of the healthcare infrastructure because of the increased burden of cases that were coming in. And the women in the informal sector, the families in the informal sector were just left with nowhere to go. And there were also cases where there was loss of family, and but there was no space to grieve. So something I would like to refer to as the luxury of grief. So they did not have the luxury to grieve. When we were talking to our members, there was one specific case study in which one of our members said that she had lost her son, but she had to continue working through the lockdown, through the tragedy, sorry, because she did not have time or space to grieve. She had lost her husband because her husband had died due to the grief that had come from losing a son, and she had daughters too. And she herself was so worried about her daughters and how she would earn or continue with her livelihood and provide for her daughters, that she absolutely did not have the time and space to grieve. It was like she had gone numb. She was a home based worker based in Delhi. She went back to her village and she was absolutely uncertain about what the future held for her. So, when we talk about formal sector workers, if we have a tragedy in our family, if there's a death or if there's a loss, and there were many, if you talk about the second wave, we could at least take time away from work, take leaves, take time to grieve, come back. Informal sector workers did not have that luxury. So that was a huge setback for them. Apart from this, medical expenses, apart from the COVID one. So in a lot of cases, this also came up that even if they had not been personally affected by the pandemic from a health perspective, or someone from the family had not fallen sick, they had other health issues that they were struggling with. Or if there were, say, pregnant women in the family, children in the family who were struggling with something, they could not find access to health services that would help them, and also medicines. So the medical infrastructure was so burdened by the cases that were coming in from because of the pandemic, they could not pay attention to the other sicknesses and illnesses that people were having to deal with, and the exacerbated effect of this was felt by people in the informal sector. And across trades, across the women that we talked to, the main areas of concern were income, livelihood, food security, and health. A lot of these women who we had talked to had also taken loans under the Pradhan Mantri Rozgar Yojana just for survival, because they had to cover expenses of their day-to-day lives. They had to take out a loan, and the stress of that loan was also adding to their other stressors. There were also cases of uncooperative landlords that were pushing for rent to be paid. So apart from all of that, they also had to worry about rent, which resulted in a lot of people going back to their villages. So a combination of all of these things made the second wave especially challenging for the informal sector workers. Most of them reported not being prepared or not having expected the second wave to have come with such ferocity, and their just made them really vulnerable to the effects of the pandemic.
Okay. Thank you for that insight. Could you elaborate a little bit about maybe the major barriers preventing workers from the informal sector in accessing any of the social protection or relief schemes that the government had laid out during the pandemic?
Yes, of course. I'll take examples of trades, because if I try to cover all of the trades and all of the aspects, it'll be a very vague and long answer.
Yeah,
so
sure.
I'll specifically talk about construction workers and home-based or domestic workers. So touching on construction workers, they have a board. Like, there's an act, the Building and Other Construction Workers Act, under which there's a mandatory welfare cess that is collected from whatever construction projects that are done. And if we talk about the first wave, during the first wave, the government had directed the welfare cess. The government had directed that it has to be used for direct cash transfers to the construction workers, so that they can be helped, and it can help them tide over the pandemic if they don't have work. But the thing is, this was just for construction workers who were registered with the board. Those who were not registered with the board, they fell through. Now, briefly, if we talk about the benefits that were being given to the construction workers, there was a direct benefit transfer to registered workers under the act using cess funds. Then and because of this, 18 states had around 18 states had transferred 1,000 to 5,000 to bank accounts of registered construction workers that were hit by the pandemic. And this was a good thing that helped them. But again, repeating my earlier point, India had 32 million construction workers registered under the act, but there is around a gap of 26 million construction workers who are not registered under the act, and therefore would not have received the direct benefit transfer. And these construction workers who were not registered, because of whatever reasons, there could be many reasons because of which they were not registered, and because of that, they would not even receive a very small amount that would help them tide over the pandemic. So this is something that is being especially called out by all unions and SEVA too, in terms of if there are workers that are not registered with a certain board, no matter what that trade is. I'm taking the example of construction workers here, but it can be any trade. If there exists a board and there are registered workers, but there are also non-registered registered workers in such a large number, there has to be efforts made to register the members who are not, because when there is a crisis like the pandemic, they fall through, they cannot access these benefits. So just putting out benefits does not help. It has to be made sure that the benefits is reaching those who need it. If I take another example of the Jan Dhan account relief measure, so it was decided that 500 would be deposited in Jan Dhan accounts across India. So one challenge that came up when we talked to our members was in rural areas or even in urban areas in some cities, it so happened that the transportation was an issue. So even though 500 would come into their Jan Dhan bank account. They would not be able to access it because, one, they would have to travel long distances, which was not possible in the pandemic. The cost of traveling long distances would be much higher than, say, 500 rupees, which does not make sense for them practically. There were also fears of police brutality in cities and in rural areas. So if you're seen traveling beyond the specified times, there would be cases of police brutality, and to protect themselves from this, they would not access that money. So when a particular scheme is announced by the government in case times of crisis and otherwise too, they have to make sure that it reaches the needy, and there are mechanisms put in place that can help support the women or the people in the informal sector access those benefits. Otherwise, there's no point in putting out benefits. If we take the example of home-based workers and domestic workers, which is an important example, they often seem to get invisibilized in any conversation around informal sector workers. So there was no targeted space for them in the relief measures. They were especially vulnerable because there are no boards. Like construction workers at least have a board for them. Home-based workers and domestic workers do not have boards that are helping them. There are many unions like SEVA, which are backing them and have been constantly advocating for a mechanism for them to get similar sorts of benefits, especially in times of crisis. But there are no such existing boards as such. So there were also demands for, say, resident welfare associations in Delhi to ensure that workers get paid by employers. And government did not make targeted comments when it came to the plight of domestic workers and home-based workers either. So domestic workers, they were in a precarious situation because they were not getting income from a lot of the households they were working with, and on top of that, they were not able to access a lot of the social security measures too, because the general ones, say for example the ration, the PDS relief measures, they could access that. But again, when it comes to the PDS relief measures, there's the added issue of the food not being enough, and this is across sectors, across trades. Most women said that they had gotten access to the PDS ration system through which they got food, but often there was this added worry of the food not lasting the whole family. So coming back to my point and summarizing it, if we are talking about construction workers who have a board, then there should be attention paid to workers that are not registered with the board, so that each and every one of them, if they're needy, if there's a crisis, they can access schemes that benefit them. If you're talking about workers that do not have a board, like say domestic workers or home-based workers, then there should be special measures, targeted measures taken for trades like these, so that they don't fall through the cracks and they also have some sort of social security that they can depend on in times of crisis and otherwise.
Emin, you mentioned that your research was predominantly with social enterprises. So could you highlight the impact of COVID on these social enterprises and also women's workforce participation?
Yeah, sure. So when it comes to women's workforce participation, there have been multiple reports where it has been said that the women's workforce participation has gone down because of the pandemic, both across formal and informal sector. If I'm talking about the informal sector workers, along with the pressures of the pandemic, there was also the added stress of increased care work, increased domestic household work and responsibilities, which added to their anxiety, along with other stressors such as uncertainty about income and health. And also, when we are talking about social enterprises, for example, I will take the example of Ruab, which is an enterprise that I've talked about earlier also. When we are talking about Ruab, in Ruab, most workers are home-based workers. And initially, if you're talking about the first wave, it so happened that the orders went down because Ruab is actually an enterprise that works, puts out saris, luxury saris, and clothes as products. But they had to improvise because of the pandemic, because the demand for these products had really gone down. No one was buying these because obviously they were not the priority products. And the first time they started production after the COVID first wave, they had decided that they'll go into the making of cotton masks, because they had to improvise if they were to continue providing a livelihood for the women that were associated with Ruab. So they, when they got into this, the women who were home-based workers who were associated with Ruab did not have an idea on how to stitch the masks or how to go about it, but they tackled this by making videos on how to stitch masks and coordinating virtually and training them and sort of upskilling them. A quick upskilling sort of initiative was carried out so that the women could quickly learn how to make masks, and through that they had gotten an order of 1 lakh masks which had been fulfilled, and the women had gotten a continued source of income and livelihood through the mask making campaign that had happened. And otherwise, if the mask making campaign would not have happened, if Ruab's workers would not have gotten work through this campaign, then a lot of the women would have been left with no work and no income. And for home based workers, it's much more difficult to go on to be a part of another trade or pick up an alternative trade, because they mostly work either from homes or they go to a community center from which they prefer doing their work, and their skill sets are also very different from the general other the skill sets that are required in the other trades. If you talk about say for example, we'll take another example of Atithi, which is like a homestay social enterprise in Uttarakhand. So Uttarakhand also faced like additional issues because of its geographical terrain. It's a hilly area, and there's a lot of complications when it comes to crisis, because it becomes difficult to access services all across, whether it comes to healthcare services or any other services that we can think of. They become especially difficult to access during crisis. So with Atithi, it so happened that the guests stopped coming. So Atithi's model is such that the women themselves rent their houses for homestay services, but it's not a primary occupation. Members in Uttarakhand who open homestays, they are also involved in other work, such as mostly agricultural work, but also other trades. They had to invest their own money to restructure their houses for better and international standard homestay services for guests, but they were not able to get a return on investment, as there was lack of tourists because of COVID restriction and travels, which got exacerbated because of the second wave. And the majority of the population in Uttarakhand also migrated to other cities for livelihood, and the people who had migrated had to come back home because they had lost their jobs. So it became even more difficult for the families to survive without economic and financial support. So if we are talking about Atithi again, and Uttarakhand, and when we are talking about lack of access and also poor network availability. So poor availability of smartphones and network also restricts members from joining online meetings, or even if they do, there's like a network issue, they cannot talk properly. They prefer meeting in one place and having in-person meetings due to the network issues. And in the absence of in-person meetings, coordination and communication can be quite a task. So as I said, if I gave the example of two social enterprises under SEVA, Ruab and Atithi, both faced different sorts of issues according to the work or products and services that they provide. And similarly, there are a lot of social enterprises in SEVA across services. So we also offer financial services, we offer a range of handicraft products and services, then we offer health services, and depending on what sort of product or service the social enterprise offers, their operations were affected accordingly according to the pandemic, and most of the social enterprises had to improvise and adapt to continue to provide a livelihood and income to their members.
Okay, following up on that, as you said that because of, let's say, a demand for masks, the workers needed to be sort of upskilled or skilled in another trade so that they could sort of manufacture it during the pandemic period and find additional sources of income. I was wondering how skill training and in general, as you had mentioned, that there were a lot of network issues and in-person meetings was not really a possibility because of the lockdown. So could you elaborate on how SEVA utilizes digital technology to reach out to its target audience during the pandemic, and the core challenges, like you already mentioned some of the challenges due to network issues, but if there were any other challenges associated with transitioning to a digital platform?
Yeah, of course, because Seva's model is essentially focused on engaging with the women on ground. We have not had a very digitally oriented model because there is always a preference to go in person and talk to the members on ground wherever they are, even in the most remotest rural areas. If our members are there, we prefer to go and engage with them directly. But because of the pandemic, there was a necessity to have a certain hold on digital communication. So a lot of measures were taken to make sure that our work does not get halted because of this challenge that had come up because of the pandemic. And to tackle it, there were extensive efforts taken to switch to a digital mode of communication. So if I'm talking about, say, targeted initiatives, we had Agevan Vikas. So Agevans are community leaders, women who come forward in communities and volunteer to be leaders for the for other informal sector women workers that are there in the community. So we have an existing Agevan Vikas, Agevan development program, and in that we had included a specific training in communication tools for like, say, for example, Zoom, Google Meets, WhatsApp, using how to use these communication tools. There was a specific element of digital communication added to the module of Agevan Vikas. And this was really important because Agevans, being community leaders, act as a link between the community members and people, say, any of the teams that are working in the offices of SEVA. Agevans can act as a crucial link with the community members. So if there is any particular situation or scenario in which we are not being able to directly talk or interact with the community members, we can do it through our Agevans. And this training and upskilling was challenging because of, say, network issues or prior lack of skills when it comes to using digital tools, or even in some cases there was the absence of smartphones or tools that help use these communication platforms in itself. So if there are no smartphones or phones that support these digital communication platforms, that was also a challenge, but we worked through it. And now, after the experience of last year, most most of our Agevans across India are comfortable with using digital communication platforms. And if there are gaps in communication between, say, what we are trying to convey and the community members, they can go themselves into the community and convey the information. Or if they have WhatsApp groups with, say, women in their community, they convey the information to them through the WhatsApp groups. Whether that information is related to relief measures, important schemes, or any sort of work that we are providing, etc., that is conveyed to them. A specific sort of intervention that I would like to point out that we had taken up as a result of the second wave is the teleconsultation service. So when it came to the second wave, we rapidly mobilized our network of community leaders who are the Agevans, and they had become digitally savvy through the experiences of 2020 earlier mentioned. And in the first wave, they had used their digital skills to basically disseminate information about helplines that already existed, and, as I said, relief measures, schemes, etc., and also awareness about the pandemic and how they can protect themselves against the pandemic. In the second wave, because of poor healthcare infrastructure, access to healthcare or healthcare workers became an issue, which is what we tried to address through our teleconsultation service. So providing access to medical advice, especially for mild COVID cases who did not need hospitalization or could be prevented from becoming severe, became the focus of our teleconsultation model. So we used to have doctors that would volunteer for this work, connect to members who wanted to access the teleconsultation service through Agevans. So generally, teleconsultation services happen such that you call a number and you consult whatever that teleconsultation service might be in the context of. So even if we talk about health, if there is a teleconsultation health service, you will call a number and that person on the other end will support you in whichever way you need, whatever questions you ask. But when they were agewans, they could map the demand from the community. There was a face that was there which the community members could trust, and because of this trust, many members who had come forward and used the teleconsultation service, which had helped them deal with maybe mild symptoms, or even if it was not COVID specific, if there were any general cough, fever, or any other illnesses that they needed guidance with, they could just use the teleconsultation service and ask for whatever doubts or inquiries or medicines that they needed, any sorts of questions that they had, they could ask the doctors. And they trusted the whole process because of the presence of the Agewans as a part of the system. And for this, Agewans were also separately trained so that they could take up this responsibility and help the community members. So I mentioned two ways: the training of the Agewans in digital communication platforms throughout the first wave and the first 2020 lockdown. And in the second wave, this was our focus: providing teleconsultation services to the members or persons who needed it the most, who were not being able to access healthcare facilities or healthcare consultations. So yeah, these are the two ways in which we, if I'm to talk about it briefly and give you like targeted answers, these are the two ways in which we used digital communication platforms to modify or tackle the challenges that came with the pandemic.
Great. Thank you so much for that insight. And the SEVA model really, it does exemplify more of like an equitable access to knowledge sharing, right? Because
Yeah.
the mechanisms that you just mentioned, they're sort of trying to empower women in even the most economically stagnant communities and sort of get them there. To sort of conclude our conversation, I wanted to ask, what certain recommendations do you think that the government or the public sector really needs to focus on in order to help workers in the informal sector really bounce back and adapt to the challenges it has presented over the past year?
Yeah. So, as I mentioned earlier, first of all, there should be recognition given to trades that do not have the official recognition, like domestic workers and home-based workers. The work that home-based workers do is very skill-intensive, and they are a part of the informal sector, and they should be recognized as such, because when a specific sort of crisis happens, they also need targeted interventions from the government. They also need social security that they can depend on to tackle the challenges that come with a crisis. In the absence of that, especially if there's like a health crisis, they become especially vulnerable because they have nothing to fall back on. There are general schemes and general relief measures that are announced for the informal sector as a whole, but those are not enough. Just like there are boards and there are social security, specifically target social security measures for, say, construction workers, there should be such measures for domestic workers and home-based workers too. There is also a gendered aspect when it comes to domestic workers and home-based workers. So it is predominantly occupied by women when it comes to domestic workers and the domestic worker and home-based worker trade. And leaving it out or not having targeted interventions affects a very vast number of informal sector women and puts them in a very precarious position. So that is one of the things, and it is one of the most important things. Secondly, when it comes to, I'll talk specifically in the context of a health crisis, because that is the context right now. There should be health insurance schemes for informal sector workers too. Health insurance schemes that allow them to access healthcare services, healthcare infrastructure without worrying about losing all their savings, and in the face of loss of income too. So a lot of the women that we had talked about, they were just depending on their savings. They were borrowing into their savings to tide over the pandemic. And because they had not expected the second wave, there were a lack of social security that they could fall back on. they had to eat into their savings, and that is a huge thing, because that means that leaves them in a very precarious position. And especially if we talk about the pandemic, we do not know if there will be, say, a third wave that will be as severe as the second wave. And if that is to happen, what would happen to the informal sector workers? And if they are on top of that, even if they can work through the pandemic, if they manage to, if technically there is not a lockdown, then the workers will work because they need money to survive. If in that scenario, if they acquire the infection from somewhere, if they test COVID positive, they do not have health insurance or extra additional money apart from what they're using for their day to day existence and survival to put into the treatment and the testing and all of that. Government hospitals do provide it for free, but then there should also be health insurance that can help them tide over if there is, say, any illnesses in the family. Apart from COVID, as we talked about earlier, there are also other health illnesses that got ignored or could not be addressed because all the focus and attention was on COVID, and a lot of these illnesses can be very expensive to treat and get medicines or to get treatment for. So if they are to get proper treatment and proper medicines for the illnesses that are existing apart from COVID, then even for that, healthcare insurance is absolutely necessary. And the third, this is more idealistic, and I'm not sure what should be done for this, space to grieve. It should not be so that the informal sector workers, if they are losing a family member or if they are sick themselves, they do not have this time or space to heal or to grieve. It should not, they should not be in such a precarious position that they feel that it's absolutely necessary to go on earning and searching for ways of having an income or continuing their livelihood, and they do not have the space to take time out from their work. So there should be space for this too. These are the three aspects that I would like to touch on, the general aspects. There are many other aspects too, but I will not go into them because it will be too much of detail. But yeah, if you ask me that what are the first three things that come to your mind, these are the three most important things that come to my mind when it comes to social security and the government and the informal sector.
Thank you so much for that. I feel like you've really given very eye-opening and informative picture of how the pandemic has really affected women informal workers and how the effects have been sort of heterogeneous across trades.
Yeah.
Thank you so much for taking the time to speak with us today, and I believe our listeners will really find this very enlightening. With that, we come to the end of this episode. If you want to learn more about SEVA Bharat's work, you can log on to www.sevabharat.org. And if you like the podcast, then please do share it with others and subscribe to never miss an episode. Thank you so much for listening.